Hello everyone, I am Rhine Joseph Orgo of 4D VMA, and today I'm going to discuss Cryptosporidium. Cryptosporidium is a protozoan belong to phylum Apicomplexa, class is Protozoa, order Coccidida, family Cryptosporidae, genus Cryptosporidium, and species such as Parvum, Muris, Miliagradis, and Cryptosporidium felis. Cryptosporidium is a spore-producing parasite found in the intestine of infected people and animals. For its history, it is recognized in mice in 1907 by Ernest Edward Heiser and reported in humans in 1976 in immunocompetent child and immunosuppressed adult. It is recognized globally in 1980s and 1990s in AIDS patients and outbreaks among veterinary students. Cryptosporidium is a microscopic parasite that causes the diarrheal disease Cryptosporidiosis. Both the parasite and the disease are commonly known as crypto. The parasite is protected by an outer shell that allows it to survive outside the body for long periods of time and makes it very tolerant to chlorine disinfection. This parasite can be spread in several different ways, like drinking water and recreational waters, which is the most common way to spread the parasite. This is a leading cause of waterborne disease among humans in different parts of the world. There are at least 32 valid Cryptosporidium species, some of which cause disease in humans, livestock, poultry, game birds, and companion animals. In livestock, poultry, and game birds, Cryptosporidium parvum, Andersoni, Bailey, and Miliagradis have been reported to cause morbidity and outbreaks of disease. In humans, Cryptosporidium parvum, hominis, Miliagradis, and Cuniculus are considered the main pathogenic species causing sporadic disease and outbreaks. Most cases of Cryptosporidiosis in young mammalian livestock are likely to be caused by Cryptosporidium parvum, which is also the most significant zoonotic threat for humans. Among many of the Cryptosporidium species, the Cryptosporidium parvum is the most important due to its zoonotic value. It is an important cause of scurr in young, unweaned farm livestock including calves, lambs, goat kid, alpaca, and foals, showing adverse consequences for productivity. Its infection to cattle are considered endemic globally. Prevalence and severity of disease peak in the second week of life. Cryptosporidium parvum appears pathogenic to piglets, causing inappetence, depression, vomiting, or diarrhea. For its morphology, Cryptosporidium species are infective form of oocysts. They are spherical, oval, and about 5 micron in diameter. They do not stain with iodine and acid fast. They are thick-walled but 20% thin-walled autoinfection. They are composed of 4 crescent-shaped sporozoids and is very hard and resistant to 60 degrees temperature, sequential application of ozone and chlorine. The enterocyte brush border microvilli immediately adjacent to the parasite are typically elongated. For its life cycle, in terms of asexual reproduction, Cryptosporidium species undergo merogony or schizogony, wherein merozoites exit the enterocyte and infect the microvillous border of other enterocytes and gauge through merogony again. In terms of its sexual reproduction, the final generation of merozoites exit the enterocyte and infect the microvillous border of other enterocytes undergo gametogamy. A microgamete fuses with a microgamete forming a zygote. In terms of sporogony or sporulation, Zygotes within the oocyst goes through sporogony forming 4 sporozoites. Sporulation occurs within the lumen of the host gut, thus making the oocyst immediately infectious. In terms of its dissemination, it composed of 2 types, the thin-walled oocyst and thick-walled oocyst. The thin-walled oocysts have thin cyst walls and exist within the same host, whereas the thick-walled oocysts have thick cyst walls and exit the host in the feces. In terms of its transmission, its reservoirs are humans, cattle, and other domestic animals. Food and water contaminated by livestock, mammal, or human feces containing cyst. Outbreaks may be due to drinking water from lakes and rivers, swimming pools, and untreated groundwaters. Cysts survive water chlorination. In terms of its pathogenesis, the sporozoites adhere to the intestinal mucosa and the cells releases cytokines. An increased intestinal secretion of sodium and chloride, water absorption is inhibited. Epithelial cells damaged by parasite invasion and multiplication, as well as T-cell mediated villus atrophy. It may produce up to 10 to 20 liters of watery stools per day. For its clinical disease, calf's course is one of the most common diseases caused by Cryptosporidium species. It is usually occurs in neonatal calves and most often reported in calves from 5 to 15 days of age. Most cases are self-limiting after several days. Persistent infection may cause marked dehydration, weight loss, and emaciation. For its pathological findings, there is a large amount of watery diarrhea. There is also a presence of yellow or pale watery feces that contains mucus. The presence of subsequent severe dehydration, anorexia, debilitation is also seen. Usually, self-limiting in immunocompetent hosts and severe and lethal in immunodeficient hosts. For its symptoms occurs after 2 to 10 days after infection and can last up to 30 days. Some symptoms include diarrhea, stomach cramps, dehydration, nausea, vomiting, fever, weight loss, and sometimes no symptoms are seen. For its laboratory diagnosis, it is important to have a specimen sourced from multiple stool specimens as well as diagnostic techniques such as wet mount, modified acid fast stain, direct fluorescent antibody assay or DFA, and detection methods such as safranin stain, trichome stain, enzyme immunoassay or EIA, polymerase chain reaction or PCR, and others. For its postmortem lesions, gross lesions are not common. There is a presence of hyperemia of intestinal mucosa. The mucosal folds are markedly thickened and there are numerous pinpoint foci of hyperemia. For its microscopic lesions, there is mild to severe villus atrophy and spherical organisms in the brush border. For its treatment, some drugs are only suppressive and coccidiostats doesn't work. Fluid replacement therapy for dehydration caused by diarrhea. It is important to apply electrolyte solution and allow calf to feed on milk. There are various drugs that can be used in the treatment of Cryptosporidium infection such as nitazoxamide, paromomycin, azithromycin, as well as antiretroviral therapy. For the prevention, boiling and microfiltration of drinking water is important. Do not drink untreated water. Do not swallow recreational water. Proper human-animal waste disposal is important. Wash vegetables with detergent soap before cooking. Hand washing and use of disinfectants are necessary. For the control, it is important to have a good sanitation for young calves. provide adequate amounts of colostrum, as well as sanitation and hygiene for humans and others. Oocysts are viable for months unless exposed to extreme temperatures and disinfectants. Note that there is no vaccines available.